Hello, Assalamu alaikum students. How are you? As I promised you, I'm going to discuss the anterior triangle and its further subdivisions. So, for just recap, anterior triangle was anterior to this anterior border of the sternocleidomastoid muscle. Superiorly, it was bounded by the inferior border of the mandible till base of the mandible, and then from base of the mandible till mastoid crosses imaginary line. And in midline, there was an again imaginary line between the symphysis manti, hyoid bone, and it was bisecting the neck. So again, here you can see this was the anterior triangle as I have already discussed it in previous video. If you haven't watched my previous video, go for that. These are in sequence. Okay. Now, this anterior triangle has been further divided into four triangles. Number one is submental triangle. Mantis is this chin, and just below the chin, we have got submental triangle. And this triangle is not bilateral, it is only one in number, whereas rest of the triangles, just submandibular triangle, these are paired. This is unpaired and rest are paired. Because means submandibular triangle is on right side and left side as well. Carotid triangle is on the right side and left side is on well as well, and muscular triangle is on both sides, whereas submental triangle is present only in the unpaired form and in the midline. So again, this was again submental, submandibular, then carotid and muscular triangle. And now I'm going into the detail of these triangle one by one. Now look at this structure you are looking at, and before going to these triangles, this muscle you can see which has been cut and torn apart. This muscle is platysma. Platysma. This is a thin sheet of muscle on both sides, on left and right side as well. And beneath this platysma, we have got this is fascia, deep fascia of the neck, which is investing layer, deep fascia or investing layer has been shown. So now about the submental triangle. This is mantis chin, and here we have got submental triangle. Look at this triangle. It has got base, which is being formed by the broad, which is being formed by the hyoid bone. And you are looking at this triangle from inferior aspect, as someone has held up his or her chin, and you are looking from beneath. So this is triangle which is called submental triangle, and it has got base and apex. Apex is at the chin and base is at the hyoid bone, and on either side it is bounded by the anterior medial borders of the anterior bellies of the digastric muscles. Here you can see digastric muscle, anterior belly. I have already discussed these muscles in detail in previous video. Just for sake of, so when because if I would be going to discuss these triangles, you would be having better and clear understanding what we are talking about. So this is an submental triangle bounded by the, here we have got hyoid bone. Apex is by convergence of these two borders, right and left border, and right and left borders are being formed by the anterior bellies of the digastric muscle. And in the background here you are looking at mylohyoid muscle, and this is median raphe. So floor is being formed by the mylohyoid muscle, and roof is being formed by the deep fascia, here you can see, which has been cut here, and skin. And this submental triangle has got submental lymph nodes. If you remember, submental lymph nodes, they drain the your tip of the tongue and middle part of the lower lip and tongue frenulum, and they have got submental veins as well. And here we have got anterior belly of digastric, and this is posterior belly of digastric, and which is going to attach onto the medial side of the mastoid process at digastric notch. So between these two bellies, we have got another triangle which is called submandibular triangle or digastric triangle. Digastric triangle because it is present between the anterior and posterior belly of digastric muscle. So that's why this triangle is called digastric triangle. So digastric triangle is bounded medially by the anterior belly of digastric and posteriorly by the posterior belly of digastric and superior by the angle of the mandible, base of the mandible, inferior border of the mandible. And here you are looking at this structure is submandibular salivary gland, which almost fills this submandibular triangle. Now same structure I'm going to show you from another aspect. Here you can see this is anterior belly of digastric, this is posterior belly of digastric, and this is base of the mandible here. So between these three structures, we have got our another triangle which is called submandibular or digastric triangle, because it is present between the anterior and posterior belly, bounded by anterior posterior belly of digastric muscle. So out of triangle has got three sides. Out of those three sides, two are bounded by digastric muscle. So that's why this triangle is called digastric triangle. Digastric triangle, and superiorly it is bounded by the you know base of the mandible or inferior border of the mandible. And here you are looking at this structure here. This structure is mylohyoid muscle, as you can see, and this is posterior border of the mylohyoid muscle. And posteriorly, mylohyoid muscle makes the floor of this triangle. Anteriorly and posteriorly, floor is being formed by the hypoglossal muscle and superior constrictor, pharyngeal constrictor, which I will show you in another diagram. But right now, look at this structure. So this is mylohyoid, digastric triangle. So look at this gland. This gland is submandibular gland, and it almost fills this triangle. So what are the structures passing contents of this triangle? Submandibular gland is one of them, of the contents. Then we have got facial artery. Look at this facial artery. Then we have got facial vein. This is also content of this triangle. Then we have got a hypoglossal nerve. Look at this hypoglossal nerve, and it crosses the external internal carotid arteries and passes beneath the stylohyoid muscle, and it passes beneath the mylohyoid muscle to supply the tongue muscles. Because it is hypoglossal nerve, it supplies the tongue muscles, extrinsic tongue muscles and intrinsic tongue muscles, all of them, except for platoglossus, which is supplied by the palatal nerve supply, which is pharyngeal plexus. Now there is another nerve coming out. This nerve is nerve to mylohyoid. It is branch of the trigeminal nerve, mandibular division, inferior alveolar nerve, and it supplies the mylohyoid muscle. Mylohyoid muscle has got special nerve which is supplying it, and it is also supplies. Look at it, also supplies the anterior belly of digastric. So anterior belly of digastric is supplied by the nerve to the mylohyoid, along with mylohyoid, and posterior belly is supplied by the facial nerve. So this was about the submandibular triangle. Now this is, here we have got carotid triangle. Carotid triangle. Here, carotid triangle. Carotid triangle, it is called carotid triangle because it has got carotid sheath beneath within this triangle. Carotid sheath, we know that carotid sheath is a tubular structure which gives passage to the common carotid, internal jugular vein, vagus nerve, and there are certain lymph nodes as well. So I forgot to mention this submandibular triangle also contains the lymph nodes. So this carotid triangle is bounded anteriorly by the superior belly of omohyoid muscle. If you remember from our very first video, we talked about inferior belly of omohyoid muscle and superior belly of omohyoid muscle. So superior belly of omohyoid muscle, which is after intermediate tendon, is behind this. So, your sternocleidomastoid muscle, and superior belly is attached onto the hyoid. So medially it is, or anteriorly it is bounded by this superior belly of omohyoid muscle. And posteriorly, this triangle is bounded by the anterior border of the sternocleidomastoid muscle. And superiorly, this triangle is bounded by the, if you remember, posterior belly of digastric and stylohyoid muscle. This is stylohyoid muscle, and this is posterior belly of digastric muscle. They bound superiorly this triangle, and it has got carotid sheath passing through it. Okay, about carotid sheath we will be talking about it in another video. Then our last but least final triangle, which is called muscular triangle. Here we have got muscular triangle. Muscular triangle is, if you remember, this is muscular triangle. Midline, it is bounded by the imaginary line bisecting the neck, and superior laterally, this triangle is bounded by the superior belly of the omohyoid muscle, and inferior laterally, it is bounded by your anterior border of the sternocleidomastoid muscle. We will talk about this in good quality image. So midline, it was bounded by the imaginary line bisecting the neck into two equal halves, and superolaterally it is bounded by the superior belly of the omohyoid muscle, and inferiorly it is bounded by the anterior border of the sternocleidomastoid muscle. So there is another triangle, and this triangle contains strap muscles. These are also called strap muscles or infrahyoid muscles. Thyroid gland is lying beneath these strap muscles, thyroid cartilage, and all the structures, they lie within this triangle. So I hope I have covered the boundaries of the further division of the anterior triangle, which are submental, submandibular, carotid, and muscular triangle. So for contents, I'm going to do another video. Thank you very much.